Hi, I'm Eileen Bowden.
And I'm Eric Kroll.
And this is Asking for a Friend.
You ready to get started?
Yeah. Do blue light glasses really work, or am I just throwing money away? Is there a better alternative? Great question. So there's been a lot of studies done on this because blue light blocking glasses have been quite the rage over the last few years, and most of these studies have shown that there's not too much benefit to blue light blocking glasses. A lot of them are very expensive, so I would not recommend any patient spend a lot of money on blue light blocking glasses. The best alternative, in my opinion, is to take frequent eye breaks when you're working on the computer or doing a lot of reading or mirror work, using artificial tears frequently. Whenever we're doing working on a computer or reading, we're not blinking as much as we should, so our eyes often dry out. And so a lot of the symptoms that we're feeling are due to dryness at the surface and just needing a little bit more breaks and rest.
All right, you get to go twice in a row.
Okay. What causes cataracts? The most common cause of cataracts is age. I tell my patients if you get cataracts, it means you've lived long enough to get them. But other things can cause them too, including steroid use. A lot of times people who have eczema or things that have required a lot of topical steroids or oral steroids over their lifetime will get cataracts at a little bit of an earlier age.
I would say really a lot of other diseases that might affect the rest of the body can lead to your cataracts developing a little bit faster. The other thing that's really important is to protect yourself from UV light, so wearing sunglasses can actually delay the onset of cataracts as well. All right. What happens when you leave your contacts in for too long? That is a wonderful question. We both love and hate this question. I feel like patients want to, maximize the amount of time that those contacts last for, because contacts are not cheap. The contacts are really expensive. But the companies have all designed their dailies or their weeklies or their bi-weeklies or their monthlies kind of along guidelines with the FDA. And that's what's really safe to use. Otherwise, they can start causing other problems. So the most important thing is stay in your contacts the amount of time that the manufacturer recommends. Please take them out every night and make sure that you're washing your hands really good. The main reason for that is the thing that we worry about the most with contacts is they can cause ulcers of the eye, and that is an infection in your eye, and the ones that are specifically associated with contacts can actually eat through your eye really quickly. If it doesn't eat all the way through your eye, it can leave really bad scars, especially in the center of your vision is where those like to go. And so that can just lead you with some long-term permanent blindness. Is it my turn?
I think so.
All right.
I can't remember.
All right, what are some early signs of glaucoma? And what should I be looking out for?
So glaucoma is one of those, it's a disease that we actually sometimes label the silent thief of sight, because most of the time, most types of glaucoma are asymptomatic, meaning patients don't have symptoms and they don't even really have any visual complaints, often until glaucoma has become quite advanced. And how this affects the patient is it actually damages their peripheral vision or the outside vision first, and slowly over time it progresses towards the central vision until the patient starts to experience almost tunnel vision. So the patient often, when they start to actually have symptoms, it's often unfortunately very late in the disease, and a lot of damage has already been done. So most of the time I really say if you have any family history, or if you have any history of having high eye pressures measured in an eye exam, it's best to really have that monitored annually with thorough, complete eye exams with an ophthalmologist. All right, that's it. We're out of questions. We've had so much fun answering these great questions today. Again, this was Asking for a Friend, and I'm Eileen Bowden.
And I'm Eric Kroll. And we want to remind you as well that while we've been able to answer a lot of questions for you all today, we want to make sure that you've gone to an eye doctor and actually seen someone, because each patient and each eye is different. And these are generic answers for generic questions, but you may have individual questions specifically for your health.